Hello friends, this is the X-ray of left femur fracture, a segmental one. Segmental fracture is fractures at two sides at the same bone. So the fracture is reduced in the C-arm by longitudinal traction, and satisfactory alignment is gained. And an entry point is made from the proximal femur with an awl while the fracture is not reduced well. So we are trying a Reamer-assisted reduction in this case. So first an entry point is made as the standard manner and through the piriform fossa, and the Reamer is passed. The reamer is then adjusted to match and reduce with the distal fragment. As in this case, the proximal fragment was flexed. Now the reamer has been pushed to match the middle fragment so that alignment is achieved, and we can then pass a guide wire. The guide wire is then introduced from the proximal fragment to the middle fragment very carefully and under C-arm guidance, and proximal and middle fragments are now reduced. Now the middle and distal fragments are reduced, if luckily by the traction alone or with the help of some Steinman pin, by passing a Steinman pin in the distal fragment and reducing it well with the middle fragment, and then passing the guide wire and adjusting the jig and passing the guide wire through the distal fragment as well. So now the fracture is reduced in the proximal to middle and middle to distal fragment are all aligned, and one guide wire is placed intramedullary, reducing segmental fracture. Now when guide wire is well placed, now is standard manner. In the standard manner, the nail is passed by reaming and distal lock is fastened, and there is a gaps, so a little bit of back hammer can reduce the gap perfectly, and the procedure is completed in a standard manner after that.